The representativeness in the Axon Registry session was really exciting to sort of start to see the potential for what real-world observational data can do in neurology. If we're able to accurately capture race, ethnicity, and other socioeconomic factors, we can actually start to understand if the differences in outcomes that patients are experiencing with the same diagnoses, is it due to biological factors? Is it due to environmental factors? Is it due to racial disparities in clinical characteristics, or is it due to racial disparities in access to health care? All of this information is sort of at our fingertips, and that paper and the presentation really start to highlight the potential for the Axon Registry to unpack these really important, observations that we've been making and start to alleviate them by developing interventions, which can then also be monitored through the Axon Registry, and through that provide the iterative feedback and measurement that's going to hopefully change practice for our providers and our patients. The disparities work is really a great example of what Verana can do with the data, but really how we're thinking about it is data is changing how we do almost everything in life, including healthcare. And what the American Academy of Neurology and Verana are really committing to do is to take the data that's in the Axon Registry and provide it in a high quality way such that it can start to drive insights. For example, we recently discussed a data set around a rare disease, SMA. And once you've identified that cohort of patients and you're able to follow them over time, can we not start to see observations or outcomes that we didn't expect, or understand trends in treatment? Those kinds of questions are enabled by the development of highly curated data sets. And so that's just one example of what we've done.